Hello. My name's Dr. Jay Parkinson. I am a pediatrician and preventive medicine doctor. I started a company called Hello Health and co-founded it. That was a lot like of a secure Facebook, but for doctors and patients to interact in person and online. So now I have a company called The Future Well, and what we do is sort of we innovate health ideas and help people make them happen in the real world. So I'm going to talk to you a little today about how I believe that quality healthcare equals designed healthcare. And right now, healthcare is very much undesigned, right? But to me, the definition of design is having elegant, connected processes. Very similar to how Walt Disney designed his, excellent masterpieces of days old. So if healthcare could function like this, it would be much more efficient and much more cost-effective. But healthcare has a problem. The customers are everyone. So if you asked Apple to produce a product or something that satisfied everybody's sort of needs, they'd fail. So right now, the needs of our communities sort of outstrip the supply of what's available. So how can we design healthcare? How can we make it pretty? How can we make it functional and accessible? And how can we match up need with supply? So here's a little bit of a story I'll talk to you guys about. Right now, it's Friday, 10 p.m. You feel horrible. You've had belly pain for about a month. It's really, really bothering you. You think it might be very serious. You're scared. So what do? What's the process? Well, right now, the issue is, does the healthcare system know who you are? Wouldn't it be nice if you had your own personal profile, that the government or an entity could define the parameters of this profile so that, this healthcare system sort of knows who you are? So in the UK, they've been talking about giving every citizen a personal web page. That might be interesting because once you have that, you can connect services to that profile. So the next step is what do I do and when? Well, the first thing that we're building at The Future Well is this triage tool that maps the resources in the community, and you tell it what's wrong, and we say this is who you need, this is when you need it, and this is how much things should cost. So how do you match up who you need with you? That's one of the things that we've built into this next product is exactly that. So here's a list of 4 gastroenterologists that are great, and here they're really close to you. So this is click here to make an appointment. And then it would be interesting to find out who's best for you. Right now, you really don't have any idea who's best for you in terms of a doctor. It would be sort of interesting if we had something on the equivalent of Match.com or OkCupid to look at a doctor's personality, match him up with your personality, and see if you guys jive. And then it would be nice to see who's available, right? Because I think the government should be able to define a doctor's profile, what it looks like, what are the parameters, the address, where they practice, what have you. And then it would be really interesting to combine that with a defined healthcare time slot. What does that look like? What are the parameters? What are the technological parameters around that? So that you could essentially do a kayak.com-like search for healthcare services. This is called the D card. This is what a doctor's profile would look like. And if you could connect the calendar, maybe you could even connect inventory. So, and open these things up via an API so that you could do a search to find out where the closest doctor is, available in an hour, with the H1N1 vaccine in stock. And then how do you schedule the services today? Well, right now it's that telephone game, right? It's Friday, so you have to wait till Monday to, call the doctor, and you might have to call 9 before you get in. With a system like this, and it's just stupid simple stuff like a profile and a time slot, you could just simply go, like you reserve a zip car, and you could reserve a doctor's time. So then what can you expect? Right now, you don't know what's going to happen at the visit, so we should be able to say, based on what the symptoms you're having, the doctor's probably going to want to scope you, for example. And you're told not to sort of, read, or not, you're told not to eat steak after 5 p.m. or something like that. And then everything is clear, and then the doctor gets, a note saying, there's a patient coming for example, who needs a scope. So we should allot some time for that. And then how do you share your records? So once you have a profile, how do you share them? So it would be really interesting if a doctor could just say, because you're sort of connecting all these silos, right, in the healthcare system. So I believe strongly that you should be in control of your own profile, your own data, and who has access to it. Because all these silos are happening in the internet and in physical spaces, and the only thing connecting them is you. So Dr. Blewett wants your access. Do you say yes or no? So what's the visit experience look like as well? Does Dr. Blewett say, I'm running 2 hours late? Here's a text message. Does Dr. Blewett allow you to check into his office? What does it look like? Is it beautiful? Does it look like some, rough places that nobody wants to go into? Is there a customer experience map associated with them? But then the next thing is, how do doctors learn about me, for example? They could have an interactive infographic about your health data that they can dive into and find out how you live your life. You could connect your Foursquare check-ins and your daily burn caloric intake and your sleep cycle iPhone app to your profile if you give it access. And then the doctor could look at all this information and see how well you're doing in your daily life. So then how do doctors communicate a plan to you? Well, it would be really nice to be able to see your plan, because right now you forget about 85% of what your doctor says. So it'd be great to be able to just log in and see what your doctor said, and also have a link to say, why should I do this? A lot of people don't understand why, one of the orders is important to them. And it would be even better if you could connect these plans to people on the outside world that can help you. Maybe a health buddy, for example, that can help you take care of your sort of need to lose weight. And then how do doctors ensure safety in the system? Right now, we have things like the surgical safety checklist. It saves a ton of lives every year, even though it's not really used on a widespread basis. But I think it would be really nice to turn treatment protocols, actual treatment protocols, into something that doctors use and share and comment on and rate and review. And patients can actually do the same thing, rating treatment protocols. And once you have a protocol, you can have standardized quality because the doctors are doing the same thing. So you can standardize that. You're different for every doctor. But if the doctor can standardize this stuff, it would be excellent. And then you could actually turn this into a game for doctors. So we want doctors to use protocols, right? Because it standardizes things. So how can you give them either money or social capital, just like Foursquare is doing? How can you do that for helping doctors standardize their practice? So then how do doctors order services in this new system? Well, right now it's, the old fax. Most of the time, in about 80% of doctors' offices, they fax an order to the lab. It would be great if you could essentially just share your profile with that lab, and the doctor could comment on it and what have you. And whenever the lab has done the test, how does the lab talk back with the doctors? Well, right now it's faxed. You sign off on it physically. It would be great if you could essentially just use, you could upload those results into the patient's profile and comment on them, just like sharing a link on Facebook. So how do these services then talk with me? Well, it would be excellent too if you've got, you get an alert saying you've got 3 new results and 1 new comment in your profile login to see all this information about you. But the important point here is that, healthcare is never going to be able to solve everybody's problems. We have to pick our customers, and I think we have to start small with those who get it. I think we need to start small with the doctors who get it and the patients that get it and want this because it's a better experience for everyone. So I think that it's okay to define your customer. And I think it's okay to have an opt-in process for those who are very interested in having a sort of new streamlined designed system. So thank you very much.